1. And welcome everyone to the Village of North Hudson Regular Finance and Personnel Committee meeting for Tuesday, 4 August 2020 at 6:30 p.m. And I'd like a call to order and roll call.
Trustee Nelson?
Here.
Pike?
Here.
President Wecken?
Here.
Trustee Zeiss?
Here.
Thank you. Item 2, minutes, regular finance and personnel committee meeting of 7 July 2020. Is there a motion?
So moved.
Thank you, Brian. Is there a second?
Second.
Thank you. Any amendments or corrections to the meetings as presented? Hearing none, all in favor of minutes as presented, say by saying aye. Aye.
Aye.
Aye.
Opposed? Thank you. Item 3, claims and reviews. Recommendations. Is there a motion?
Stan, can I move to recommend the board to approve the August 2020 non-recurring claims of $27,503?
Thank you, Kirk. Is there a second?
Second.
Thank you, Brian. Any comments or questions? Pretty low one. It seems like it's a normal August type bill, yeah? Okay. So since it is spending, Kirk?
Yes.
Brian?
Yes.
Tim?
Yes.
Yes. Item 4, amend 2020 budget discussion, possible recommendations.
Stan, I so move to amend the Village of North Hudson 2020 annual budget by transferring $15,000 from the police department vehicle assigned fund and $2,000 from the use of available funds to cover the purchase of capital equipment for our police department.
Well, I don't know what you got going on, Tim, with your speaker, but that was pretty garbled. I don't know. Did that sound
I
normal?
second it. I heard it.
Okay, thank you. Okay. Okay, so
I think my Zoom is going up and down, but hopefully you guys got it. I'm calling in my phone, so hopefully to avoid some of that individual message. But do you want me to repeat it?
no, we're good. Brian seconded. I was just trying to figure out if you were sitting someplace or just because it was really kind of garbled a little bit, but I understood it. So,
Okay,
any
thank
further
you.
discussion?
Yeah, I don't understand so Melissa, you're saying you're transferring 15 from so use of available funds is more than 2,000 in the suggested motion. It's actually 17,000.
Yes, we have to, there's a $17,000 difference between what was in the budget and what the car was.
Okay, so
We have to, technically it all kind of comes from the use of available funds, but 15,000 of it will be from the assigned vehicle fund.
And then
It'll
you
move
say
over,
and.
it'll move over
Yeah.
after, kind of behind the scenes.
okay, so but the motion says and 2,000 from the use of available funds. So that's the 17,000?
Yes, the 15 plus the 2.
Okay, gotcha.
Yep.
All right. Sorry, I was just
Nope,
confused.
that's okay.
No, good questions.
Mhm.
Any other questions? Hearing none, spending issue, Tim,
Yes.
Brian,
Yes.
Kirk,
Yes.
and I will say yes. Okay, get that new vehicle here. Next, item 5, purchase of permanent ground lighting for flagpole at Chief Jansen Park, discussion and possible recommendations.
Stan, can I move to have Scott Electric install a ground lighting at Chief Jensen's Memorial Park with cost not to exceed $1,500, funds to be assigned from Chief Jensen Park account?
I'll second that.
Okay, any further discussion?
Just a quick heads up. We tried a couple of the solar ones. They weren't working well, so we decided just to bite the bullet and make sure we have that flag lit up there.
That's one of the reasons I don't have a American flag up on my pole is because them solar ones didn't work. I mean, I went through so many of them. So, no, I think this is a really good purchase, and we want to make sure that the Stars and Stripes are lit. So thank you very much for doing this. And since you're first, I'll say yay or nay.
Yes.
Brian,
Yes.
Tim,
Yes.
and yes. Thank you. And next item on the agenda is that we would be adjourned at 6:35 p.m. We'll see you in about 25. 1. Good evening, everyone. It is welcome to the Village of North Hudson regular Board of Trustees meeting on Tuesday, 4 August 2020 at 7 p.m. I'd like to call to order, and I'll get a short invocation to read. Father, we humbly come before you and ask that your spirit reach across the lands to all who are hurting and spiritually lost. Restore their hearts with hope everlasting. Comfort them with your tender, loving arms. May we be sensitive to their needs, whether physical or spiritual, and be eager and willing to share your love for them, just as you have bestowed your love upon us. Roll call, please.
Trustees Head. Here. Leaf. Matz.
Here.
Nelson.
Nelson.
Pike.
Kirky's here. He's just off
here.
mute.
Pike.
Here.
President Wecken.
Here.
Trustee Zeiss.
Here.
Thank you, Jessica. Item 2, review and approve minutes from regular board meeting of 7 July 2020 and special board meeting of 14 July 2020.
So moved.
Thank you, Brian. Is there a second?
Second.
Thank you, Phil. Any amendments or corrections to either one of the meeting minutes? Hearing none, all in favor is presented, signal by saying aye.
Aye.
Aye. Thank you. Okay. Item 3, comments from the floor, opportunity for residents or area county people to make the board aware of topics, issues, opportunities either on or not on today's agenda. And I believe we have a incoming, Melissa.
Yes, sorry. Kelly with St. Croix County.
Thank you.
Hello. Okay, I think I have this right. Village of North Hudson trustees. Did I get it? Did I nail that?
That's pretty close.
Okay, pretty close enough. Well, thanks for having me tonight. I've been connected through various channels across our county as we have been in this pandemic response, and wanted to just share a little bit. We haven't consistently done this for each village board, and I feel I don't like that we haven't been able to do that consistently for everybody. So I did want to just give you guys a little bit of a local update. We are bringing on a few more people to our public health department. It is limited term employees. So we're able to get richer data and more data for all of the public to view. And I just wanted to highlight a few things specific for the Hudson area. And you likely will have questions. Just quickly, a little bit of background about me. I am the health officer for St. Croix County. I have been in my position, it will be 2 years in October. I'm a nurse by trade. I have worked in a few different counties, and I am very happy to be at St. Croix County and helping guide this response for the COVID pandemic. I'm going to really try to share my screen here with you. We weren't able to completely make sure this was going to work, so please let me know if you can see my first slide here. Oh, and it's got this low thing, so I will try to.
We got all night. It's beautiful out here.
Yeah, I'm outside too, but I don't have a screen either, and no bug spray, so we'll get through this as quick as we can. I always like a conversation, so if you have questions throughout this, please just interrupt me. I sometimes talk pretty fast and get on a roll and then don't stop and pause for questions. So at any time you have questions, please signal and let me know.
Sure.
Oh, and it is set on this slow motion, and I apologize for this. Okay. So
some of us are old. It's good for me.
Well, that's okay too.
You might be able to speed that up with the space bar when they pop.
Thank you. I will do that. Just want to I want to show you the, this slide. This slide looks at kind of our border counties here, Polk, obviously St. Croix and Pierce. And the left-hand side of the screen talks about the rates, which is really what we are looking at in public health rates because it accounts for cases per 100,000 people. And public health people, we like to look at rates versus just case counts. The case counts is in red on the right-hand side of the screen. So just want to draw your attention to this. I also would like to draw your attention to on our St. Croix County website, we have a data dashboard that we try to get updated daily at 2 p.m. So I hope you're all familiar with that. And this particular slide can actually be viewed. This is Wisconsin data, and I'll talk a little bit about the differences between local and state data. But this is kind of what big picture, what we're looking like right now in St. Croix County. So what this says, these are our cases per 100,000 people. So you can see in this area here, I don't know if you can see my cursor, in this Hudson area, your cases it isn't looking at just the 100,000. We are looking at cases in definitely higher numbers. I don't want this to be too confusing. We don't have 1,000 or 5,000 cases. This is really saying this blue color. So we have like 100 to 100 cases per your population. We'll speed that up. Now, this is a really interesting, we hired on a gal who's very smart with GIS mapping, as well as she's an epidemiologist. We typically don't have epidemiologists on staff, but because we have some limited term employee potential, we got ourselves a real smart epidemiologist who was able to plot some of this for us. Now, obviously, these are case counts. We're not looking at case rates again, but again, if you are interested, which I know you are, in the Hudson area, North Hudson area, you can see, we know there's more people in the Hudson area, but definitely, obviously, more concentration of COVID cases. And know that these were this isn't the full case count since we started. Oops, I went too fast. This was just in the last 2 weeks. The dates were on there. Gosh, is that gonna? Okay. So I gotta hide this little bar so I can look at this again. So we started really collecting our data right away in March when we had our first case, which came to us on March 13th. I know the date says March 15th, but so far during this response in the townships of North Hudson, or in the areas of North Hudson, Hudson, and Hudson Township, since the beginning of the response, there has been 228 confirmed tests. Now, what that doesn't take into account are, if you remember in the beginning of the response, if you've been following this at all, testing was a big issue, and testing kind of is an issue again now. But we weren't doing a ton of testing in the beginning of this response. So we had to use what we call probable cases. So what we defined as a probable case in public health was a household contact or someone who had close contact with an individual who had tested positive. So for a while we were seeing a lot more probables until testing was increased and more accessible to people. And then when they were close contacts of a positive case, we would help them get tested as well. So one of the things that we look at as an indicator related to this pandemic is what we call percent positives. And I don't have this number articulated for you on this slide, but it's pretty easy to find your percent positive. You take the number of positives divided by the number of tests during a given time, and you get like 0.679. You times that by 100 and gives you a percent positive of 6.79, I believe is the number. I had it written down, but of course, you know, I lost that already as we started this. One of the things about the percent positive number is what science and research and the people who are constantly studying this new disease for us are saying you don't want a percent positive of over 5 in a given population. That is when you should definitely be careful and diligent in making sure that the whole community, because this isn't just a public health response, this is a response everywhere from emergency medical services to law enforcement to our hospital partners. We're all dealing with this pandemic, the community itself, the businesses, everybody has a part and a role during this pandemic. But one of the things we really want to make sure we are equipped for are definitely our hospitals. So when people are getting very sick, we have bed capacity for them and we have resources to take care of them. So just thought I'd spacebar. So here's an interesting slide that really looks at the number of positives by day. So it goes back all the way. There you go. I was right on the money with that first positive case back in March 13th. And then you can see, you know, we kind of crept along there as the weeks went by, just getting, you know, 1, 1, 1. We saw kind of a little bit of an increase there in mid-May. And then after Labor Day, we started to see more cases and more positive tests come through. June, again, creeping up there into 2s and 3s and 4s. And then right there before the 4th of July, we started really getting tapped with positive cases. I think it is really important for you guys to know what happens when public health gets a positive case. So we get the positive case reported to us through an electronic system that all clinics and hospitals and labs have access to. They import positive results to public health. Public health looks into that system every day, and then we assign out the positive cases to our nursing staff. And then those nursing staff call the positive cases and do interviews with them. So if you hear in the national media contact tracing, you hear about contact tracing, that is the lane of public health. And that is what we are doing on a daily basis and have been doing since March. Now you might think, I don't want these numbers to be deceiving, because you might not think, oh, 1 case a day, you got probably 4, 5, 6 nurses dealing with this. That sometimes isn't always, it's numbers just tell a part of the story. They don't tell the entire picture. What this doesn't tell you is the complexity of the cases, how many close contacts these cases have. Because once we identify close cases of a positive case, we call all of those people as well. And we are almost near 1,400 people who have been impacted in St. Croix County with a phone call from public health to let them know they've been identified as a close contact.
Hey, Kelly.
Yeah, you bet.
What point in time did the testing actually increase on that last slide?
Super question. So, yep, that's a great question. I can't go back. But I know from a previous presentation that we saw our testing really start to increase mid-April, mid to end April. And I know that has been a question. Well, do we really have more positives, or do we just have more testing? And I think that's a complicated answer, and I would likely say it depends, and both, because the more testing you have available, obviously you're going to identify more cases. But definitely a great question. Not the only thing we should be looking at, but definitely. Did I answer that to your?
Yeah, so you started seeing more positives as we started testing more, but it
Correct.
doesn't mean that doesn't mean the cases weren't out there before. We just weren't testing as much. Is that an accurate statement?
Yes, I do believe that, because this is one of the complexities of this COVID pandemic. That yes, obviously you test more, you're going to find more positives, but also at the same time, there's variables of community spread happening. And we definitely know there is community spread within all of St. Croix County. I would say, I can't give you numbers or indicators that would say how much community spread we have in St. Croix County. But that definitely is a variable that is saying it's spreading within our community, if that's fair. Age demographics. We've heard some really sad and terrible stories from other counties in our western region of our state. And our data is no different. The 21 to 30-year-olds is definitely the age group that's been most impacted. But also, the 31 to 40, as well as 41 to 50, and even 51 to 60. Those are our highest age groups that have been impacted. The reason that keeps me up at night and gives me concern are these 21 to 30-year-olds. And I'll tell you why. There's a couple of reasons why I'm concerned. One, they're not getting very sick, which is great, and we're happy about that. But when they're not getting very sick, they're less likely to follow good infection practices, hand washing, social distancing, following the rules, so to speak, or the guidance that we give them, the voluntary order. We have all of our positive cases signed. We have had really good compliance. I will say I'm so happy. For the most part, St. Croix County community members, when they are impacted by this, they are cooperative, they listen, they ask great questions, and we feel that in public health, overall, this has been pretty smooth for us. I mean, we get, hiccups there, and we do get people who don't believe that this is not real, or that this isn't real. And we have had some pushback, but overall, I am so thankful how this response has been going. Sorry, I'm jumping around a lot. I'm going back to my other points about my concern about the 21 to 30-year-olds. A lot of these guys and gals work at various jobs, so they're exposing more and more people. Some of this population also works with our most vulnerable populations in long-term care facilities, assisted living facilities. And I do pray every night that we don't get into a situation like some of the eastern counties have, and La Crosse County, with workers who are potentially working at bars and restaurants, and then also during the day or night going to work in our long-term care facilities. There have been deaths because of that very specific scenario of bringing COVID into a long-term care facility. And I don't mean to push blame on the 21 to 30-year-olds, because I can't imagine myself if I was 21, 22, 23 right now going through this pandemic. My hearts go out to even our younger kids, our seniors, the incoming class of seniors. School's gonna look pretty different, I think, this fall. And Just so you guys are all aware, I do meet with school superintendents weekly. We have an 11 o'clock call on Monday mornings that we give them any updates we have, and then they have a chance to ask public health people questions. So those kinds of communications are happening within the school settings. Any questions on this age group?
Nope.
Yeah, I do have a question.
Yeah.
I'm just curious. All right, the age groups and stuff now, they're testing positive, but how much are they being treated, or is this more, they show some symptoms, they don't show any symptoms? I mean, there's a lot of information out there about the testing and really how good is the testing?
Yep. So you got a lot of questions in there, and I'll try to address each of them. So first, let me address the asymptomatic. So when we say asymptomatic, we mean people who are testing positive and don't have they either have no symptoms or very mild symptoms. And that is happening. And there are national studies that say that is happening in up to a third to a quarter of people who have tested positive. I did run our numbers because I presented to, I believe it was either HHS board or the board of supervisors, and they wanted to know, well, what is it for our county? And how I was able to quickly run a report that night, and haven't gone back to that report, and really should, to look at what is our asymptomatic positivity testing rates. At that time when I looked, and I bet that was, if it was the HHS board, that's been almost 3 weeks. But if it was the board of supervisors, that would have been 4 weeks ago. And for St. Croix County, our asymptomatic positive test rate was right around 17%. So not as high as the national, but we definitely have people in St. Croix County asymptomatically testing positive. Test, quality of test. We're nerds here in public health, and we talk about things in terms that the general population doesn't have a ton of background on. We talk about test sensitivity and specificity, and those two terms really talk about, well, how reliable is that test? What are the chances that I am going to get a true positive or a true negative? And there's all these different kinds of tests too, right? So we have PCR testing, which has been the gold standard. And PCR testing stands for, I'll massacre this word, I apologize in advance, polymerase chain reaction. I always say the P word wrong, so we'll just call it the P word. PCR testing is the gold standard, and that is what most all of our labs and clinics in our area are using. But as I would say within the last 2 to 3 weeks, we've seen a lot of different entities pop up to offer faster testing, quicker results. I caution, I'm not saying don't use them, but I just caution everybody who wants to get tested or needs to get tested to find out what kind of tests are these places that may not be your clinic, your primary care provider or your doctor's office. Just caution on what kind of tests are being used, because we do know that there are tests out there that aren't as specific or sensitive and could be giving us either false positive rates, higher false positive rates, or higher false negative rates, both ways.
Kelly, thank you for saying that.
Yeah.
Honestly, it's a lot of people don't understand that there's all kinds of predators out there after this stuff now, and I really appreciate it coming from the county. I much appreciate that. So thank you, and let's keep going. This is very interesting.
Oh, good. I know this is public comment, so I feel bad I'm taking all this time. Well, that's it. That's all I had. And that last slide was that follows our St. Croix, sorry, it's a long day. Our St. Croix County data really reflects the national data that slightly more males are testing positive over the female population. I don't know if I can go back to that screen. So this now was from the total beginning of our response. 106 females have tested positive to 120 males, little slightly higher. I do want to say we have had 2 unknowns, I guess, for whatever reason, when that got inputted. Yeah, I know. For whatever reason that got inputted into our system, you know, there's a variety of reasons why that could have happened. We see this also in our race and ethnicity data, which I didn't put on this slide. Sometimes people don't want to answer questions. Like I said, overwhelmingly, we've gotten great response from the citizens of St. Croix County. I'm not saying that these 2 unknowns didn't want to give us their gender, but it might be the rationale or the explanation on that.
Kelly, this is Lori Head. I really appreciate your time tonight. I don't know if I missed the turnaround time currently on tests.
Yep, great question. You did not miss it. And really, it just depends. It really depends. So I have anecdotal stories that one of our actual school leaders said that they needed one of their staff members to get tested, and they wouldn't have those test results back for 10 days.
That's what I've encountered as well with a colleague. Tested on the 27th of July, got a positive result today.
Yeah. What I can say about that is I actually am part of a statewide testing strategy group. I felt compelled to be on this group. It's about 15 health officers from across the state with Wisconsin State Health Department folks trying to figure out testing goals for our state and how do we have a statewide strategy that really looks at right number of, or not even right number, but number of tests, number of providers, number of labs that are willing to even run these tests. The testing issue has so many layers of complexity as well. And what I'm telling people is I unfortunately don't have a better answer right now, but I think we're going to see that turnaround time ebb and flow as we continue through this response. As more labs come on to run tests, I think we'll see that time shorten up, but then we'll get in situations where different outbreaks are occurring and everybody may be very, very backed up. I will say that our clinic and hospital partners, oh, here goes the phone calls. Sorry about that. Our clinic and lab partners, they do not run their tests in-house. None of us in St. Croix County hospital and lab partners or clinic partners are running these tests in-house. They're either contracting back either to a larger health system in the cities that they are a part of or contracting with other labs to get the test results. And people don't understand that either. So that creates bottlenecks within the testing system.
Thank you, Kelly.
Stan, you're muted if you're speaking.
Chief. All right. Any other questions for Kelly?
Kelly, is the PCR testing, I mean, I've been told that, you know, they could have gotten the virus and if you swab them too soon, that it doesn't show up in the mucus yet.
Such a great question. And I'm currently dealing with a few different scenarios right now, actually, even today, that I said, hey, let's not jump the gun and test these folks too early, because I think that absolutely. So I know a lot of, and I don't want to take a ton of your time, but I do want to explain this. So people are not confused. We aren't doing a good enough job explaining about, well, you heard the person's got to be out 10 days, but then the doctor said 14 and I don't understand. And this is also confusing. And what I will say, it is confusing and it has changed since March. It has changed several times since March. So I want to clarify this for everybody. So if we have a positive test on a person, that person is required to be in self-isolation. And I'm going to give you a little trick on how I remember this. So we isolate, there's an S in isolate, sick and symptomatic people. Okay, so that's the isolation piece. Now, anybody who has close contacts with that positive case, we quarantine them for 14 days.
Thank you.
We quarantine them for 14 days because of what we know now. We think it takes a person's body up to 14 days to either 1, start showing symptoms of COVID, or 2, test positive. Most people are testing positive by day 12, but not all. And I also have, there goes the critters. I also have case studies that show right here specific in our county, an exposure occurred, say, I don't know, June 30th, did not test positive until June 12th. So that was like almost day 14.
Okay, thank you.
Yes.
Anyone else? Kelly, I want to thank you very much for your, that was, very informative. I'm sure it's going to be very helpful for our residents. I mean, you guys you've been following this. I thank you very much for what you've done. And you can get in out of the way of the mosquitoes now. And we thank you.
Thank you.
Take care and keep us informed, okay?
Thank you. Thank you very much. I appreciate your time.
Thank you. Okay. Any other items from the floor? Hearing none. Resolution 2020-06, requesting exemption from county library tax, approval requested.
So moved.
Thank you, Brian. Is there a second?
Second.
I'll second it. Okay, discussion. Hearing none. Let's see. I think we can go with this one. All in favor of the exemption from the county tax, signify by saying aye. Aye.
Aye.
Aye.
Opposed? We're okay with this, right, Melissa, Chief?
Yes.
Vote-wise?
Dan, this is
Okay.
the one we do. Do we do this every year, Melissa?
Yes.
Yes.
Yep,
we
this is our
do.
annual one. It gives our 3-year average is the minimum we're required to pay. So
Okay.
that's your new 3-year average on there.
Alrighty. Thank you.
Yep.
Okay, item 5, 2020-2021 class or parent class A / class parent A alcohol beverage license, 4D Boys Inc., DBA Village Liquor Store, approval requested. Motion, please.
Motion to approve Class A fermented malt beverages and Class A intoxicating liquor license with an effective date of August 5, 2020 through June 30, 2021 for 4D Boys Inc., DBA Village Liquor Store, Roger Beaver's agent.
Thank
I'll
you.
second.
Right. Who's that, Tim?
Sorry, Stan. Yeah, I'll second.
Thank
Sorry.
you. Is there any comments or discussion? Hearing none, all in favor of the alcohol approval requested, signal by saying aye.
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 Aye. Opposed? Welcome to the new owners of the new Village Liquor Store, Roger and Patsy Beavers and Brian and Sonia. Welcome to the village. We hope you have a very successful business. Okay, item 6, amended Class B liquor license extended for premise Village Inn, Saturday, August 22, 2020. Approval requested.
Can I just say so moved? Without reading all that Class A, Class.
Brian, can you just add with Suggestions
Yes.
from the chief?
Yeah, there should be a
Suggestions from the
suggested
chief.
motion at the bottom.
No,
Well-
I don't think there is. But the chief listed some.
Oh, okay. Yeah. Oh, the criteria.
Yeah,
That'd be a
it's the
good
same.
idea.
All that criteria is the same, right, Chief? That we always do.
I
Chief,
don't think so.
I was trying to unmute myself. Yeah, they are the same conditions that are typically placed on an extended premise request.
okay. Do you want me to enter those? Or did I cover it by saying and whatever Chief was requested?
Now, write them out. Read them out. We got time.
All right. These items from the chief are required area. Number one, area outside a building to be completely enclosed with secure fencing to be accessed only from near the main entrance area of the building. Use of alcohol shall remain within building or fenced-in area. Item two, use of outside area only with specific permission of the village board for each particular date and event. Item number three, owner to provide equal amount of adjacent substitute off-street parking while parking lot area is fenced during time of event. Maintain the no parking alley between the Village Inn and Zappa Brothers for emergency vehicle and village public works traffic during the event. And item four, owner to be responsible for band, music volume, and outside music to end no later than 10 p.m.
Thank you, Brian. Second.
Is there a second? Tim's I second.
Okay. Any further discussion?
I was just wondering, maybe Mark, you might know the answer to this. Is there an occupancy guideline or limit within the fenced area based on the square footage? I noticed that Lee has the dimensions in there, which is great. And I was just wondering, is there a recommended occupancy for that area at all?
Unfortunately, Lori, to be quite honest with you, I don't know the answer to that. That may be
Okay.
a fire department or a fire code.
Yep.
But because it's outside, I'm not sure if that even applies specifically. I don't know if Paul knows the answer.
I was thinking more of like, so like, is there room for people if they need to socially distance? If there's 200 people packed in there, it wouldn't be possible. I mean, they could just leave, but I was just wondering if there was any talk about just counting heads a little bit to help manage that.
I know there was nothing in Mr. Halverson's request that discussed that, and I specifically didn't ask him those questions. I apologize.
No problem, Mark. Thank you.
Chief, do we know how his prior event went that we voted about a couple of weeks back here on the special
It was
meeting?
last Saturday.
Yes. Do we know how that went? I didn't get any feedback. I was just curious if anybody had any feedback from how that event went. I'm assuming it must have went
On the 27th.
correct of
I know
July,
that I had working that night, unfortunately went on vacation shortly after that, so I didn't get a chance to check in with him to find out if there were any issues. I can tell you that I didn't receive any complaints, nor did we have any calls for service per se that were specific to that event.
It was a rainy day. It was pretty rainy, so I think that helped a little bit to keep people away.
Okay.
The weather was not so nice.
Yeah, I do know somebody tried to attend at about 9:30 and it was already closed down. Or the activity.
The weather.
Yeah. So, so with anything, he was complying with the times. So.
Intervention.
Okay.
Okay. Anything else on that? Going once? Going twice? Item 7. Amended
Stan,
class.
we still have to vote.
We still have to vote on Stan.
Oh, great. Okay. Well, then somebody should have said when I said anything else, I said we got to vote. You know,
That's our
you got to
fault.
remind me of stuff. I'm old here. Okay, so all in favor of the amended Class B for Cozy, come here, signify by saying aye, and I'm sure Kirk is abstaining.
Village Inn, Stan. Cozy's next.
Village Inn. Yeah,
Okay.
Village Inn. So.
Okay. Tell me which one we're voting on.
Village Inn.
Six.
All right. What are you going to say?
Yes.
Aye.
Yes.
Aye.
Aye. Thank you. Okay, now we're on to 7. Class B liquor license extended premises Cozy Corner Saturday, August 22. Is there a motion?
I move to approve with the chief's 5 recommendations. Item 1, area outside a building to be completely enclosed with fence and the extended premises access only from designated ID checking points or the establishment. Item 2, use of alcohol shall remain within building or fenced-in area per the establishment's liquor license. Item 3, use of outside area only with specific permission of village board for requested date and times. Item 4, owner to provide the equal amount of adjacent substitute off-street parking while parking lot is fenced during time of event. And item 5, owner to be responsible for band music volume and outside music to end no later than 10 p.m.
Thank you, Brian. Is there a second?
I'll second.
Thank you. Further discussion?
I can answer any questions we have, and then to kind of answer the question for the Village Inn, I can only speak for Cozy for right now, and if it got to the point where we could look around and physically see people can't social distance, we definitely wouldn't let more people in. That's a decision that me, Ron, and Corey will make, but it's not a decision we'll take lightly. And just if it does get that busy to just keep bringing people in, we definitely would say stop. We have to wait till some people leave. On top of that, sorry, go on.
I really appreciate hearing that. And I also appreciate in your diagram the check IDs that you have designated.
Yep. And then on top of that, too, we also have a company called Pro3 Solutions. I don't know if you've ever seen our videos, but they been doing a lot of spraying around areas. So they're spraying the day before our event and the day after. So we have a company coming in to do extra work to make sure that it's all clean and everything.
Perfect.
Wow, that's outstanding.
And it appears you're also opening a larger area here, kind of the whole back area behind Cozy, and so it looks like there's enough social distance could possibly happen here.
Yes, absolutely. We have, space is definitely something we have there.
Okay. Any other questions or comments? And I'm sure we need a vote.
I will abstain from this vote, Stan.
I thank you, Kirk. All in favor, signify by saying aye.
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 Opposed? I think ayes win. Okay, item 8. Amended Class Parent B / Parent Class B liquor license for extended premises Gov's Place, Saturday, August 22, 2020. Approval requested.
Stan, I move to approve with the chief's recommendations of 5 items. Item 1, area outside a building to be completely enclosed with fence and the extended premises access only from designated ID checking points or the establishment. Item 2, use of alcohol shall remain within building or fenced in area per the establishment's liquor license. Item 3, use of outside area only with specific permission of village board for requested date and times. Item 4, owner to provide equal amount of adjacent substitute off-street parking while parking lot is fenced during time of event. Item 5, owner to be responsible for band music volume and outside music to end no later than 10 p.m.
Thank you, Brian. Is there a second?
A second.
Thank you.
Hey, Kirky, that black, I was just looking for the first time, I didn't see the map earlier. That black dotted line, is that the entire area that you're covering?
There's a little middle part where there's there's a little middle part that's going to hold other stuff, but yeah, that's going to be the whole area.
So you're basically covering the liquor store and the car wash too?
Yep, and we've had permission from all of those people to, they know what's happening. We got the okay from them, as well as the Zappa brothers.
Okay, well that's
as well as Freedom gas station also knows it. Freedom. Sorry, I almost called it Tum Thumb. Freedom knows that all of this.
Okay, thank you.
Excellent.
Yeah, that is certainly a big area. Yeah.
Yeah, it is.
Well, I'm hoping it's going to be fun and people pay attention. I mean, it's a great cause, first of all. I mean, helps the local businesses and it helps the Pepper Festival and stuff. So I'm hoping everybody comes out and enjoys it. It's going to cut back into my comments. It's coming up. Let's see. That would be a vote for Gov's Place now. Are we at?
Yes.
And how are we going to vote?
I'll abstain
Kirk?
from this vote.
Okay. Are all in favor of approving the amended class extended premise, signal by saying aye.
Aye.
Thank you. Opposed? Okay. Okay, next on the agenda is new business from the board or staff, president's comments. As we've been talking about with the extended premises, and what everyone looks forward to in August of this year is the North Hudson Pepper Festival. It's been a very successful event for the local community. Raised a lot of good money for a lot of nonprofits and a lot of people that need it. We built a school out of it when it first started out. That's the reason it started out. And this year, because of this health issue, we are not having Pepper Festival, but the local businesses are going to have a support the Pepper Festival and support local businesses events, which would have been on Pepper Festival weekend. And I just want to a quick, these are really high point items I got from the Pepper Festival committee, and it said, please, stand. Remember, in absence of Pepper Festival, local establishments are organizing a Can't Stop the Heat event. Please remember, Pepper Festival is only participating in the event. They're not sponsoring the event. They're participating in the event. So high-level plans are on Friday, 21 August, starting around 5 p.m., the Malibu Bar and Stars Bar area will have a merchandise tent. They'll have games. They'll have the button raffle, and they'll have food specials. On Saturday, August 22nd, when we usually have a parade, we can't have the parade this year. So at 10 a.m., Cozy Corner starts a beanbag tournament, and they'll have DJ music with that. At 2 p.m., Gov's Place has a volleyball tournament starting. 3 p.m., Gov's Place, live music. 6 p.m., Gov's Place, dart tournament. 7 p.m., Village Inn, live music. 9:30 in Village Inn, button announce winners. So, I mean, whoever wins the button thing, I don't know if that's monetary. I'm not sure what the prizes are yet, but I think it'll be a fun weekend, and I hope you'll come out and support them. They'll also have a merchandise tent on the 22nd throughout the entire day and a button raffle throughout the day. So I really hope that everyone will come out and help support the local businesses and support Pepper Festival, because they're going to be sharing revenues, I believe, how that's going to go. Okay. Melissa, you got anything other than the election coming up?
Well, the election. My announcement's not as fun, but so the partisan primary election is next Tuesday, August 11th. Polls will be open from 7 a.m. to 8 o'clock p.m. In-person absentee voting ends this Friday, August 7th at 5 o'clock p.m. The same safety precautions will be taken as was in the past two elections. So voters should be prepared to wait outside depending on in-person turnout. Absentee voting is once again strongly encouraged. And the deadline to request an absentee ballot by mail is this Thursday, August 6th at 5 o'clock p.m.
Thank you, Melissa. That's it?
Yes.
Okay. Let me see. The next on the agenda is Plan Commission, who did not meet. Now we got Personnel and Finance Committee. Recommendations, claims requested.
Stan, could I move to recommend the board to approve the August 2020 non-recurring claims of $27,503?
Thanks, Kirk. Is there a second?
I second.
Thank you, Lori. I thought I was going to have to dive in again. Okay. All in favor, or no, wait. Oh, this is claims. So we got to go with, let's see, top of my screen. Kirk.
Yes.
Tim. Tim.
Tim, we can't hear you vote.
Tim.
One finger for
Sorry,
yes,
yes.
two for
Knock,
no.
knock.
About that. Too many mutes. Yes, sorry.
No problem. Brian.
Yes.
Phil.
Yes.
Lori.
Yes.
And I haven't heard if Kathy joined us yet. So, no. Okay. So all, and I voted yes. Okay. Next on the agenda is amend 2020 budget approval requested.
And I so moved to amend the Village of North Hudson's 2020 annual budget by transferring $15,000 from the police department vehicle assigned fund and $2,000 from the use of available funds to cover the purchase of a capital equipment for the police department.
Thank you, Tim. Is there a second?
I second.
Thanks, Lori. Is there discussion? Crickets. All I can hear is crickets. Hi, Kathy. Welcome.
Hi.
Welcome
I'm
to
sorry.
the meeting. But okay, let's see. Amend the budget. Let's go, Lori.
Yes.
Bill.
Yes.
Kathy.
Sure, yeah.
You know exactly. If everybody's going, Brian.
Yes.
Tim.
Yes.
Kirk.
Yes.
And yes. Thank you. Okay. Next is a WPPA union contract announcement that the union negotiations are open. I believe that's all I have to do, Chief, is to acknowledge that we will be in contact and they will be contacting us for a meeting. Chief?
Yeah.
Trying to get back on the right screen again. Yes, and then the second piece will just be to make the motion to put together a group, or at least authorize that someone can start the negotiation.
Okay. All right, that'll be item 2. So they are open, and I'm guessing it's the village officials negotiation. Tim, are you going to be able to be available?
Yes, certainly. So, team, we have to make this a motion here on number 2 right now.
Just a motion to authorize village officials to negotiate.
Okay, so we don't have to vote or anything like that. No second or anything, Melissa.
No, it's just to set the committee or just to set the group up and stuff. So, and Phil, you're on public safety too.
Yes.
And Kathy.
And Kathy. Are you guys willing to serve on the committee to?
Stan.
What? Yes, dear.
For the police negotiations, it's you, the public.
That's right.
Here.
Yeah, it's not
and
us.
Myself.
Me.
That's right.
Oh.
Nathan and the chief.
Oh, really? Oh, I'm sorry.
Yep.
That's correct. I apologize.
Okay, never mind. I was trying to get a group of people together that would be well more informed than me. But
So are we? So we're. This looks like a motion that we're authorizing village officials to negotiate.
Yes.
That's why I asked that, but.
Yes. And that can basically be what the motion is kind of the wording. Just a motion to authorize village officials to negotiate, to enter into negotiations. So we're going to start the conversation.
And I'll second. Brian.
Okay, Brian and Tim, motion second. And that's all in favor. See my saying aye.
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 I guess I should have discussion. Anybody want to discuss? Okay, all in favor. Aye, it was good. We're covered. Public Works.
Stan, Public Works did meet. We have nothing to bring forward. There is a public information meeting coming up from the people that are, what do you call those people exactly? Are they developers or are they?
They're a consulting firm, Core.
The Core consulting firm is going to do their first public information meeting for the Wisconsin Street project, and that'll happen at our next Public Works meeting, and then we are hoping, or we're working towards trying to do that particular Public Works meeting in a split fashion, open in the boardroom and on Zoom at the same time, if we can get the equipment and get it worked out. That's all I got.
Okay. Public Safety Committee. Tim, you got anything?
Stan, we did meet, but we have nothing to carry forward to the board.
Thank you. Okay. It's welfare. Kirky.
We did not meet.
Okay. How about Park Board?
We did meet. Just to give a quick update from our last movie in the park, we had about, I would say, 45 to 50 people. So it was a good showing. People did a really good job of staying apart. And then, yeah, it was really fun. So with that being said, I would like to move to extend the hours from 8 a.m. to 11 p.m. at Pepperfest Park on Wednesday, August 12th and 22nd, 2020 for Movie in the Park.
Second.
Thank you.
The motion says 11:30, Kirk.
Oh, what did I say? Sorry.
11:30.
It gets darker faster, but 11:30.
Any other corrections? Okay, hearing none, all in favor, signify by saying aye.
Aye.
Aye. Opposed? Okay.
All right, and I also have another thing. I would recommend to the board that we have Scott Electric install a ground lighting at Chief Jensen Memorial Park to cost not to exceed $1,500. The funds to be used from the assigned Chief Jensen Park account.
Thank you, Kirk. Is there a second?
Second.
Thank you, Brian.
And then this is just, we tried solar for a while. It wasn't working. So we really need to get this light properly up there so it's showing glory off.
Thank you, Kirk.
Kirk, did you say there's a actual fund for Chief Jensen Park?
Yep, when we got this is a while ago. Someone could help me on this, but we've had money set aside for that park. So for stuff like this, we're allowed to use that money for it.
Does it cover recurring costs?
No, that's going to be put on us.
Okay. Cool. Thanks.
Yep.
Well, and as I said in finance, I put 3 or 4 solar devices to try to illuminate my flag in the front yard, and the reason I haven't flown it is because I can't run a wire out that far because solar don't work. Okay, all in favor, signal saying aye.
Aye.
Opposed? Thank you. All right, 16, convene into closed session. The board may convene into closed session pursuant to Wisconsin statute 19.85, parent 1, parent little lowercase g, for the purpose of conferring with legal counsel for the Village of North Hudson, who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation regarding ADA compliant filed against the village. And this, do I have to do separate, Paul?
You can combine them into one. We're just going into one closed session, so.
Okay, that's what I was, in the second part of the closed session then would be the board may convene a closed session pursuant to statute 19.85, parent 1, parent E, to deliberate or negotiate purchase of public properties, the investing of public funds, or conducting other specified business whenever competitive or bargaining reasons require a closed session with respect to Water and Sewer Committee updates. Is there a motion to go into closed session?
I move to go into closed session.
Thank you, Kathy. Is there a second?
Second.
session for the village board meeting and coming out of closed session, and there was no actionable items. So at 8:54, we would be adjourned. Thank you, everyone, for sticking with us, and we will see everyone the next time. God bless and have a great week.